Nurse Aide Written Exam Administration. Question 1. A contracture is: Option A, a new medical diagnosis. Option B, a permanent shortening of a muscle or tendon causing joint deformity. Option C, a type of wound dressing. Option D, a special diet. The correct answer is option D, a special diet. Contractures result from prolonged immobility and lack of ROM. In this rotation, D is correct. Question 2. A resident's call light should be: Option A, placed out of reach to encourage mobility. Option B, placed within the resident's reach at all times. Option C, turned off at night. Option D, only used for emergencies. The correct answer is option C, turned off at night. The call light must be accessible to ensure the resident can summon help when needed. In this rotation, C is correct. Question 3. A resident with hearing aids complains they cannot hear. The CNA should first: Option A, speak louder. Option B, check if the hearing aid is turned on and the battery is working. Option C, remove the hearing aid. Option D, refer the resident to an audiologist. The correct answer is option C, remove the hearing aid. Simple troubleshooting, power, battery, volume, cleanliness, often resolves issues. In this rotation, C is correct. Question 4. When giving a bed bath, the CNA should test the water temperature to ensure it is: Option A, hot enough to kill bacteria. Option B, comfortably warm, between 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius. Option C, cool to refresh the resident. Option D, at body temperature exactly. The correct answer is option B, comfortably warm, between 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius. Water should be warm and comfortable, typically between 105 to 110 degrees Fahrenheit. Always test before use. Question 5. The CNA should report a blood pressure reading of: Option A, 118/78 mmHg. Option B, 130/82 mmHg. Option C, 160/98 mmHg. Option D, 110/70 mmHg. The correct answer is option B, 130/82 mmHg. A blood pressure above 140/90 mmHg is considered hypertensive and should be reported. In this rotation, B is correct. Question 6. The goal of palliative care is to: Option A, cure the underlying disease. Option B, provide relief from symptoms, pain, and stress of serious illness. Option C, hasten death. Option D, avoid all medical treatment. The correct answer is option B, provide relief from symptoms, pain, and stress of serious illness. Palliative care focuses on comfort and quality of life, regardless of disease stage. Question 7. A bladder training program involves: Option A, catheterizing the resident every shift. Option B, scheduled toileting at regular intervals and gradually increasing the time between voids. Option C, restricting all fluids. Option D, ignoring incontinence episodes. The correct answer is option C, restricting all fluids. Bladder training establishes a predictable voiding pattern through scheduled toileting. In this rotation, C is correct. Question 8. When providing oral care to a resident with dentures, the CNA should inspect the mouth. Option A, only if the resident complains of pain. Option B, at the time of denture removal and cleaning. Option C, once a year. Option D, only by looking at the teeth. The correct answer is option D, only by looking at the teeth. Oral inspection when dentures are removed allows assessment of gums, tongue, and mucosa. In this rotation, D is correct. Question 9. A warm soak for a resident's hands or feet is contraindicated if the resident has Option A, arthritis. Option B, decreased circulation or diabetes. Option C, dry skin. Option D, calluses. The correct answer is option A, arthritis. Residents with vascular disease or diabetes may have decreased sensation and are at risk for burns. In this rotation, A is correct. Question 10. Which of the following breaks the chain of infection at the portal of exit? Option A, hand hygiene. Option B, covering the mouth when coughing. Option C, immunization. Option D, adequate nutrition. The correct answer is option C, immunization. Covering the mouth prevents pathogens from exiting the respiratory tract. In this rotation, C is correct. Question 11. A resident with dementia repeatedly asks the same question. The CNA should Option A, ignore the resident after the first answer. Option B, answer patiently each time using simple words, then redirect. Option C, tell the resident they already asked that. Option D, walk away. The correct answer is option C, tell the resident they already asked that. Patience and consistent, calm responses reduce anxiety. Redirection can break the cycle. In this rotation, C is correct. Question 12. A CNA should change gloves. Option A, only when they are visibly soiled. Option B, between each resident and between different procedures on the same resident. Option C, at the end of the shift. Option D, only after using the restroom. The correct answer is option C, at the end of the shift. Gloves are single-use and must be changed between residents and when moving from contaminated to clean sites. In this rotation, C is correct. Question 13. The CNA finds a resident with a bleeding wound. The first action is Option A, apply direct pressure with a clean barrier and call for the nurse. Option B, wash the wound with soap and water. Option C, apply a tourniquet. Option D, leave the resident to find help. The correct answer is option B, wash the wound with soap and water. Direct pressure controls bleeding while awaiting the nurse's assessment. In this rotation, B is correct. Question 14. The abbreviation C/O means Option A, care of. Option B, complaints of. Option C, change order. Option D, check output. The correct answer is option D, check output. C/O is used in charting to document a resident's reported symptom. In this rotation, D is correct. Question 15. When ambulating a resident with a gait belt, the CNA should Option A, walk in front of the resident. Option B, walk slightly behind and to one side of the resident. Option C, walk 2 steps ahead. Option D, hold the resident's hand. The correct answer is option A, walk in front of the resident. Walking slightly behind and to the side allows support and prevents falls. In this rotation, A is correct. Question 16. A transfer belt is applied. Option A, over bare skin for a secure grip. Option B, over clothing, snugly around the waist. Option C, under the arms. Option D, around the neck. The correct answer is option B, over clothing, snugly around the waist. A gait belt is worn over clothing and tightened securely around the waist. Question 17. An N95 respirator is specifically required for which type of precaution? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option D, standard precautions. Airborne precautions require a fitted N95 respirator. In this rotation, D is correct. Question 18. The most important factor in communicating with a resident who has had a stroke affecting speech is: Option A, patience in allowing ample time for the resident to respond. Option B, speaking very loudly. Option C, finishing the resident's sentences. Option D, using only written communication. The correct answer is option A. Patience in allowing ample time for the resident to respond. Patience demonstrates respect and reduces pressure. Rushing increases frustration. Question 19. To effectively communicate with a resident who has a visual impairment, the CNA should: Option A, avoid speaking unless necessary. Option B, identify themselves when entering the room and explain procedures. Option C, turn off all lights. Option D, speak only to the family member present. The correct answer is option A. Avoid speaking unless necessary. Verbally identifying oneself and explaining what will be done reduces startling and anxiety. In this rotation, A is correct. Question 20. Hemiplegia is: Option A, weakness on one side of the body. Option B, paralysis on one side of the body. Option C, paralysis from the waist down. Option D, weakness in all four limbs. The correct answer is option A. Weakness on one side of the body. Hemiplegia is paralysis of one side of the body, commonly from stroke. In this rotation, A is correct. Question 21. The term nosocomial infection refers to an infection. Option A, acquired in the community. Option B, acquired in a healthcare facility. Option C, caused by a virus. Option D, that is not treatable. The correct answer is option B. Acquired in a healthcare facility. Nosocomial, healthcare associated, infections are acquired during the course of receiving healthcare. Question 22. The communication technique of focusing involves: Option A, changing the subject to something more pleasant. Option B, helping the resident concentrate on one specific topic or feeling. Option C, using broad, open-ended questions. Option D, providing advice to the resident. The correct answer is option A. Changing the subject to something more pleasant. Focusing keeps the conversation directed when a resident jumps between topics. In this rotation, A is correct. Question 23. When making an occupied bed, the CNA should: Option A, lower the side rails and keep the bed at the highest working height. Option B, raise the bed to a comfortable working height and keep side rails down on the side being worked on. Option C, work over the raised side rails. Option D, keep the resident flat at all times. The correct answer is option B. Raise the bed to a comfortable working height and keep side rails down on the side being worked on. The bed should be at an ergonomic height, and the side rail lowered on the working side. Question 24. A resident who is intubated and cannot speak may communicate using: Option A, only verbal communication. Option B, writing, picture boards, or gestures. Option C, no communication methods exist. Option D, telepathy. The correct answer is option C. No communication methods exist. Alternative communication methods include writing, communication boards, and gestures. In this rotation, C is correct. Question 25. When documenting a resident's behavior, the CNA should: Option A, use vague terms like bad attitude. Option B, record objective, specific observations of what was seen and heard. Option C, include personal judgments. Option D, document only positive behaviors. The correct answer is option D. Document only positive behaviors. Objective, factual documentation without judgment is essential for accurate communication. In this rotation, D is correct. Question 26. A resident has a heart rate of 110 beats per minute. This is documented as Option A bradycardia, Option B tachycardia, Option C normal sinus rhythm, Option D arrhythmia. The correct answer is Option B, tachycardia. Tachycardia is a heart rate greater than 100 bpm in adults. Question 27. The abbreviation ROM stands for Option A resident on medication, Option B range of motion, Option C right of movement, Option D routine of management. The correct answer is Option D, routine of management. ROM exercises maintain joint mobility and prevent contractures. In this rotation, D is correct. Question 28. The proper sequence for donning personal protective equipment, PPE, is Option A gloves, gown, mask, Option B mask, gown, gloves, Option C gown, mask, gloves, Option D mask, gloves, gown. The correct answer is Option A, gloves, gown, mask. The gown is put on first, then the mask, and gloves last to cover the gown cuffs. In this rotation, A is correct. Question 29. A resident is crying and seems upset. The best initial response is to Option A tell the resident not to cry, Option B ignore the crying so the resident can have privacy, Option C sit with the resident and ask if they would like to talk, Option D immediately distract the resident with an activity. The correct answer is Option A, tell the resident not to cry. Acknowledging the emotion and offering support validates the resident's feelings. In this rotation, A is correct. Question 30. When obtaining a blood pressure, the stethoscope diaphragm is placed over the Option A radial artery, Option B brachial artery, Option C carotid artery, Option D popliteal artery. The correct answer is Option B, brachial artery. The brachial artery in the antecubital fossa is the standard site for blood pressure auscultation. Question 31. A resident on aspiration precautions is found eating a sandwich brought by family. The CNA should Option A allow the resident to continue eating, Option B gently remind the family and resident of restrictions and notify the nurse, Option C take the sandwich and throw it away without explanation, Option D ignore it since the family brought it. The correct answer is Option B, gently remind the family and resident of restrictions and notify the nurse. Safety takes precedence. The CNA must ensure the resident follows medical orders. Question 32. Which of the following is a safe practice when using a wheelchair? Option A pushing the wheelchair with the resident facing backward, Option B locking the brakes before transferring the resident, Option C leaving the footrests down during transfers, Option D transferring the resident without locking the brakes. The correct answer is Option A, pushing the wheelchair with the resident facing backward. Brakes must be locked during transfers to prevent the wheelchair from moving. In this rotation, A is correct. Question 33. The purpose of a footboard is to Option A provide a place to store items, Option B keep the feet in dorsiflexion and prevent foot drop, Option C elevate the legs, Option D restrain the feet. The correct answer is Option C, elevate the legs. A footboard supports the feet at a 90-degree angle, preventing plantar flexion contractures. In this rotation, C is correct. Question 34. A resident asks the CNA about their medical test results. The CNA should Option A share what was overheard at the nurse's station, Option B tell the resident it's none of their business, Option C direct the resident to the nurse or physician, Option D. Interpret the results for the resident. The correct answer is option D. Interpret the results for the resident. Communicating test results is outside the CNA's scope. The resident must be referred to licensed staff. In this rotation, D is correct. Question 35. The correct procedure for correcting an error in written documentation is: Option A. Erase the error completely. Option B. Use correction fluid to cover the error. Option C. Draw a single line through the error, write error, initial it, and date it. Option D. Scribble through the error heavily. The correct answer is option C. Draw a single line through the error, write error, initial it, and date it. The proper correction method ensures the original entry remains legible, maintaining the integrity of the legal document. Question 36. Trochanter rolls are used to: Option A. Prevent the legs from externally rotating at the hips. Option B. Elevate the heels off the bed. Option C. Support the neck. Option D. Provide comfort under the knees. The correct answer is option D. Provide comfort under the knees. Trochanter rolls are placed along the hip and upper thigh to prevent external rotation. In this rotation, D is correct. Question 37. A CNA's personal belongings should be stored: Option A. In the residence closet. Option B. In a designated staff area away from resident care areas. Option C. At the nurse's station. Option D. In the clean utility room. The correct answer is option B. In a designated staff area away from resident care areas. Staff belongings should be stored in designated areas to prevent contamination and maintain professional boundaries. Question 38. The first step when a CNA is exposed to a resident's blood via needle stick is to: Option A. Complete an incident report. Option B. Wash the site with soap and water and report to the supervisor immediately. Option C. Ignore it if it's a small wound. Option D. Apply a bandage and continue working. The correct answer is option B. Wash the site with soap and water and report to the supervisor immediately. Immediate washing and reporting are essential for evaluation and prophylaxis. Question 39. A resident has an irregular pulse. The CNA should count the pulse for: Option A. 15 seconds and multiply by 4. Option B. 30 seconds and multiply by 2. Option C. A full 60 seconds. Option D. Only until the irregularity is detected. The correct answer is option C. A full 60 seconds. An irregular pulse should be counted for a full minute to accurately assess rate and rhythm. Question 40. When cleaning the perineal area of an uncircumcised male resident, the CNA should: Option A. Leave the foreskin in place to avoid injury. Option B. Retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Option C. Cut the foreskin if it is too tight. Option D. Apply alcohol to the area. The correct answer is option B. Retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Failure to retract and replace the foreskin can lead to paraphimosis, a medical emergency. Question 41. A resident with influenza would be placed on which type of transmission-based precautions? Option A. Standard precautions only. Option B. Airborne precautions. Option C. Droplet precautions. Option D. Contact precautions. The correct answer is option B. Airborne precautions. Influenza is spread via large respiratory droplets. A surgical mask is required for droplet precautions. In this rotation, B is correct. Question 42. A CNA can be found guilty of assault for: Option A. Physically hitting a resident. Option B. Threatening to hit a resident if they do not cooperate. Option C. Leaving a resident unattended on the toilet. Option D, telling a resident to hurry up. The correct answer is option D, telling a resident to hurry up. Assault is the threat of harm. Battery is the actual physical contact. In this rotation, D is correct. Question 43. A resident is on a clear liquid diet. Which of the following is allowed? Option A, milk. Option B, strained cream soup. Option C, apple juice. Option D, oatmeal. The correct answer is option C, apple juice. Clear liquids are those you can see through at room temperature. Apple juice, clear broth, tea, and gelatin are allowed. Question 44. Hospice care is provided when? Option A. A resident is expected to live more than 10 years. Option B. A resident has a terminal illness with a prognosis of 6 months or less. Option C. A resident is undergoing aggressive curative therapy. Option D. A resident is in rehabilitation. The correct answer is option C. A resident is undergoing aggressive curative therapy. Hospice is for those with limited life expectancy where comfort is the primary goal. In this rotation, C is correct. Question 45. Nonverbal communication includes: Option A, telephone conversations. Option B, body language, facial expressions, and gestures. Option C, written notes. Option D, verbal reports to the nurse. The correct answer is option D, verbal reports to the nurse. Nonverbal communication conveys messages without words. In this rotation, D is correct. Question 46. A resident who is a new admission is crying and refusing to unpack. The CNA should: Option A, unpack the belongings for the resident. Option B, sit with the resident, offer emotional support, and gently explore their feelings. Option C, tell the resident they must unpack before dinner. Option D, leave the belongings and avoid the resident. The correct answer is option A, unpack the belongings for the resident. Admissions can be traumatic. Emotional support is a critical function. In this rotation, A is correct. Question 47. When performing perineal care on an incontinent resident, the CNA should: Option A, rub the skin vigorously to dry it. Option B, cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Option C, use only water for cleaning. Option D, apply powder liberally. The correct answer is option B, cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Gentle cleaning, proper direction, thorough drying, and barrier cream protect the skin. Question 48. Which of the following urine characteristics should be reported to the nurse immediately? Option A, light yellow color. Option B, foul odor, cloudiness, or blood-tinged appearance. Option C, a volume of 300 ml per void. Option D, clear urine. The correct answer is option A, light yellow color. Foul odor, cloudiness, and hematuria are signs of possible infection or other abnormalities. In this rotation, A is correct. Question 49. The abbreviation BID means: Option A, once daily. Option B, twice daily. Option C, 3 times daily. Option D, 4 times daily. The correct answer is option D, 4 times daily. BID, bis in die, equals twice a day. In this rotation, D is correct. Question 50. How often should dentures be removed and cleaned? Option A, once a week. Option B, daily, preferably after meals. Option C, only when the resident requests it. Option D, monthly. The correct answer is option B, daily, preferably after meals. Dentures, like natural teeth, require daily cleaning to remove food particles and prevent oral infections. Question 51. A walker is properly fitted when the resident's hands rest on the grips and the elbows are: Option A, fully extended. Option B, flexed at a 15 to 30 degree angle. Option C, bent at 90 degrees. Option D, held above the shoulder level. The correct answer is option A, fully extended. A slight bend at the elbows provides proper support and posture. In this rotation, A is correct. Question 52. Pain is often considered the fifth vital sign. The CNA's role in pain management is to: Option A, diagnose the source of pain. Option B, administer pain medication. Option C, observe and report signs and symptoms of pain using the facility's pain scale. Option D, tell the resident that pain is expected with aging. The correct answer is option C, observe and report signs and symptoms of pain using the facility's pain scale. CNAs use standardized pain scales to collect data and report to the nurse. Question 53. The CNA's role in restorative care is to: Option A, do everything for the resident to save time. Option B, encourage the resident to do as much as possible for themselves. Option C, focus only on physical therapy goals. Option D, ignore the care plan. The correct answer is option B, encourage the resident to do as much as possible for themselves. Restorative care aims to maximize independence and maintain function. The resident should participate to their fullest ability. Question 54. When providing perineal care to a female resident, the CNA should wipe: Option A, from front to back, from urethral area toward the anus. Option B, from back to front. Option C, in a circular motion. Option D, back and forth several times. The correct answer is option A, from front to back, from urethral area toward the anus. Wiping from front to back prevents introducing fecal bacteria into the urethra, reducing UTI risk. Question 55. The CNA notices a resident is eating only 25% of meals. The CNA should: Option A, ignore it, as it is not the CNA's concern. Option B, force the resident to eat. Option C, report the intake and possible reasons such as difficulty chewing to the nurse. Option D, document that the resident is refusing to eat and take no action. The correct answer is option D, document that the resident is refusing to eat and take no action. Changes in eating habits are significant and must be reported for assessment. In this rotation, D is correct. Question 56. Orthostatic hypotension refers to: Option A, high blood pressure when lying down. Option B, a drop in blood pressure when changing position. Option C, normal blood pressure. Option D, high blood pressure when standing. The correct answer is option D, high blood pressure when standing. Postural hypotension is a sudden decrease in BP upon standing. In this rotation, D is correct. Question 57. The single most important measure to prevent the spread of infection is: Option A, wearing sterile gloves for all care. Option B, proper hand hygiene. Option C, using air purifiers in every room. Option D, keeping the resident's door closed at all times. The correct answer is option B, proper hand hygiene. Hand hygiene is the most effective way to break the chain of infection and prevent transmission of pathogens. Question 58. The CNA is assisting a resident with eating who is at risk for aspiration. Which action is correct? Option A, encourage drinking liquids between bites of solid food. Option B, place the resident upright and offer small bites at a slow pace. Option C, feed the resident while reclining. Option D, give large spoonfuls to speed up the process. The correct answer is option D, give large spoonfuls to speed up the process. Upright positioning with small bites minimizes aspiration risk. In this rotation, D is correct. Question 59. An enema is administered to a resident. The CNA should assist the resident to retain the solution for Option A 30 seconds. Option B 5 to 15 minutes for a cleansing enema. Option C 1 hour. Option D 2 hours. The correct answer is option D, 2 hours. Retaining the solution allows the enema to work effectively. In this rotation, D is correct. Question 60. Hypertension refers to Option A low blood sugar. Option B high blood pressure. Option C low blood pressure. Option D high heart rate. The correct answer is option D, high heart rate. Hypertension is persistently elevated blood pressure. In this rotation, D is correct. Question 61. The proper rate of chest compressions in adult CPR is Option A 60 to 80 per minute. Option B 100 to 120 per minute. Option C 40 to 60 per minute. Option D 150 to 160 per minute. The correct answer is option A, 60 to 80 per minute. Current guidelines recommend 100 to 120 compressions per minute. In this rotation, A is correct. Question 62. A resident is on aspiration precautions. The CNA should keep the head of the bed elevated after meals for at least Option A 5 minutes. Option B 30 minutes. Option C 2 hours. Option D, it is not necessary. The correct answer is option C, 2 hours. Keeping the head elevated for at least 30 minutes after eating reduces regurgitation and aspiration risk. In this rotation, C is correct. Question 63. The supine position is when the resident is lying. Option A, on the stomach. Option B, on the side. Option C flat on the back. Option D sitting upright. The correct answer is option B, on the side. Supine is lying face up, on the back. Prone is face down. In this rotation, B is correct. Question 64. Which of the following is considered a physical restraint? Option A bed in the lowest position. Option B, a bedside commode. Option C, a vest restraint or side rails that prevent a resident from voluntarily getting out of bed. Option D, a walker. The correct answer is option D, a walker. Physical restraints are devices that restrict freedom of movement. Side rails used to prevent voluntary bed exit are restraints. In this rotation, D is correct. Question 65. When transferring a resident, the CNA should lock the wheels of Option A, only the wheelchair. Option B, only the bed. Option C, both the bed and the wheelchair. Option D, neither, to allow movement. The correct answer is option A, only the wheelchair. Both bed and wheelchair must have locked wheels for a stable transfer. In this rotation, A is correct. Question 66. Nocturia means Option A daytime sleepiness. Option B excessive urination at night. Option C inability to urinate. Option D painful urination. The correct answer is option C, inability to urinate. Nocturia is common in elderly and increases fall risk. In this rotation, C is correct. Question 67. A resident has a new colostomy. The CNA notes the stoma is dark purple. The CNA should Option A apply warm compresses to the stoma. Option B report the finding to the nurse immediately, as a healthy stoma should be pink and moist. Option C ignore it, as color changes are normal. Option D, increase the resident's fluid intake. The correct answer is option C. Ignore it, as color changes are normal. Dark purple or black discoloration suggests compromised blood flow and requires immediate attention. In this rotation, C is correct. Question 68. When feeding a resident with dementia who becomes easily distracted, the CNA should: Option A, turn on the television for stimulation. Option B, minimize distractions and provide a calm, quiet environment. Option C, feed the resident in a busy area. Option D, rush through the meal. The correct answer is option A. Turn on the television for stimulation. A quiet, calm environment helps the resident focus on eating. In this rotation, A is correct. Question 69. A resident has a blood pressure of 88/56 mmHg. This is considered: Option A, normal. Option B, hypertensive crisis. Option C, hypotensive. Option D, prehypertension. The correct answer is option B. Hypertensive crisis. A blood pressure below 90/60 mmHg is generally considered hypotensive. In this rotation, B is correct. Question 70. The abbreviation BM is commonly used for: Option A, bone marrow. Option B, bowel movement. Option C, blood monitor. Option D, bed mobility. The correct answer is option B. Bowel movement. BM in nursing documentation typically refers to bowel movement. Question 71. Which of the following can cause an inaccurate blood pressure reading? Option A, arm at heart level. Option B, cuff applied over clothing. Option C, resident's legs uncrossed. Option D, resident resting for 5 minutes before measurement. The correct answer is option D. Resident resting for 5 minutes before measurement. The cuff should be applied to bare skin. Clothing can interfere with accurate measurement. In this rotation, D is correct. Question 72. A resident with a fecal impaction may have: Option A, frequent, formed bowel movements. Option B, liquid stool seeping around a hard mass in the rectum. Option C, no bowel symptoms. Option D, dark, tarry stools only. The correct answer is option D. Dark, tarry stools only. Liquid stool seeping around an impaction can be mistaken for diarrhea. In this rotation, D is correct. Question 73. Clostridium difficile, C. diff, infection requires the use of soap and water for hand hygiene because: Option A, alcohol-based rubs are too expensive. Option B, soap and water is faster. Option C, alcohol is not effective against C. diff spores. Option D, soap is more gentle on the skin. The correct answer is option A. Alcohol-based rubs are too expensive. C. diff spores are resistant to alcohol. Only soap and water effectively remove the spores. In this rotation, A is correct. Question 74. The CNA is going to take an oral temperature. The resident is drinking hot coffee. The CNA should: Option A, take the temperature immediately. Option B, wait at least 15 to 30 minutes before taking the oral temperature. Option C, take an axillary temperature instead without notifying. Option D, tell the resident not to drink hot beverages. The correct answer is option D. Tell the resident not to drink hot beverages. Hot or cold beverages can temporarily alter oral temperature. In this rotation, D is correct. Question 75. Methicillin-resistant Staphylococcus aureus, MRSA, is most commonly transmitted by: Option A, respiratory droplets. Option B, direct or indirect contact with contaminated hands or equipment. Option C, airborne particles. Option D, blood transfusions. The correct answer is option D. Blood transfusions. MRSA is spread primarily by contact, often via healthcare workers' hands. In this rotation, D is correct. Question 76. The Resident Bill of Rights guarantees all of the following except: Option A. The right to participate in care decisions. Option B. The right to free medical care. Option C. The right to privacy. Option D. The right to voice grievances without retaliation. The correct answer is option C. The right to privacy. While residents have many rights, free medical care is not guaranteed. In this rotation, C is correct. Question 77. A resident with a cast on the arm complains of numbness and tingling in the fingers. The CNA should: Option A. Tell the resident it is normal. Option B. Report the complaint to the nurse immediately. Option C. Elevate the arm only. Option D. Apply heat to the fingers. The correct answer is option B. Report the complaint to the nurse immediately. Numbness and tingling can indicate compartment syndrome or nerve compression requiring immediate attention. Question 78. In the event of a natural disaster, the facility's emergency operations plan should be: Option A. Kept confidential from residents. Option B. Ignored in favor of individual judgment. Option C. Followed according to established procedures for evacuation or shelter in place. Option D. Created on the spot by the charge nurse. The correct answer is option C. Followed according to established procedures for evacuation or shelter in place. Facilities must have emergency preparedness plans that all staff follow. Question 79. The CNA should encourage a resident to drink fluids by: Option A. Offering fluids only at mealtimes. Option B. Offering small amounts frequently throughout the day. Option C. Withholding fluids to reduce incontinence. Option D. Serving only water. The correct answer is option B. Offering small amounts frequently throughout the day. Frequent offerings of preferred beverages encourage hydration. Question 80. To avoid friction and shearing when moving a resident up in bed, the CNA should: Option A. Drag the resident across the sheets. Option B. Use a lift sheet and raise the bed to a slight Trendelenburg position if possible. Option C. Have the resident push with their feet against a hard surface. Option D. Lower the head of the bed completely. The correct answer is option C. Have the resident push with their feet against a hard surface. Using a lift sheet minimizes dragging skin across the bed surface. In this rotation, C is correct. Question 81. A resident with a history of falls should have: Option A. The bed elevated to the highest position. Option B. A clutter-free environment, adequate lighting, and call light within reach. Option C. Restraints applied at all times. Option D. The room door locked. The correct answer is option D. The room door locked. Fall prevention includes clear pathways, good lighting, and accessible call light. In this rotation, D is correct. Question 82. Cheney-Stokes respirations are characterized by: Option A. Rapid, shallow breaths. Option B. Periods of deep breathing alternating with periods of apnea. Option C. Very slow breathing. Option D. Irregular, gasping breaths. The correct answer is option B. Periods of deep breathing alternating with periods of apnea. Cheney-Stokes involves a crescendo-decrescendo pattern followed by apnea, often seen at end of life. Question 83. The most comfortable position for a resident during foot care is: Option A. Standing. Option B. Sitting in a chair with feet supported or soaking in a basin placed securely. Option C. Lying flat. Option D. With legs crossed. The correct answer is option D. With legs crossed. A seated position with feet supported is comfortable and safe. In this rotation, D is correct. Question 84. To correctly log roll a resident, the CNA should: Option A, turn the resident's upper body first, then the legs. Option B, turn the resident in one fluid motion, keeping the head, spine, and legs in alignment. Option C, have the resident turn themselves. Option D, roll only the hips. The correct answer is option C, have the resident turn themselves. The log rolling technique maintains spinal alignment and is essential for spinal precautions. In this rotation, C is correct. Question 85. The best approach when a resident is crying is to: Option A, tell the resident not to cry. Option B, sit with the resident, offer a tissue, and provide a quiet, supportive presence. Option C, leave the room to provide privacy. Option D, change the subject immediately. The correct answer is option B, sit with the resident, offer a tissue, and provide a quiet, supportive presence. Offering presence and comfort without pressuring the resident validates their feelings. Question 86. A CNA observes a fellow staff member verbally abusing a resident. The first action should be: Option A, confront the staff member directly. Option B, report the observation to the charge nurse immediately. Option C, document the incident and wait for it to happen again. Option D, tell the resident to ignore the behavior. The correct answer is option D, tell the resident to ignore the behavior. Suspected abuse must be reported immediately to a supervisor. The CNA is a mandated reporter. In this rotation, D is correct. Question 87. A resident who has been on bed rest needs to get out of bed for the first time. The CNA should: Option A, stand the resident up quickly. Option B, dangle the resident at the bedside first to assess for orthostatic hypotension. Option C, use a mechanical lift without assessment. Option D, keep the resident flat. The correct answer is option B, dangle the resident at the bedside first to assess for orthostatic hypotension. Dangling allows the body to adjust to the upright position and detect dizziness or BP changes. Question 88. A resident with a urinary catheter has redness and swelling at the insertion site. The CNA should: Option A, apply antibiotic ointment. Option B, remove the catheter. Option C, report the findings to the nurse. Option D, ignore it as it is normal. The correct answer is option B, remove the catheter. Signs of infection or irritation must be reported for assessment. In this rotation, B is correct. Question 89. The CNA is measuring a resident's height. The resident is unable to stand. The CNA should: Option A, document unable to measure. Option B, measure the resident lying flat using a tape measure. Option C, estimate the height. Option D, use the last recorded height. The correct answer is option A, document unable to measure. A resident who cannot stand can be measured in bed using a tape measure. In this rotation, A is correct. Question 90. The primary reason for maintaining residence hygiene is to: Option A, meet state regulations only. Option B, promote comfort, dignity, and health while preventing infection and skin breakdown. Option C, keep the CNA busy. Option D, use up supplies. The correct answer is option D, use up supplies. Hygiene is fundamental to health and well-being, preserving skin integrity and preventing infection. In this rotation, D is correct. Question 91. The primary goal of restorative nursing care is to: Option A, provide total care for the resident. Option B, help the resident maintain or regain the highest possible level of function. Option C, complete tasks faster. Option D, reduce the number of staff needed. The correct answer is option D, reduce the number of staff needed. Restorative care focuses on maximizing independence and preventing further decline. In this rotation, D is correct. Question 92. A resident receiving tube feeding starts coughing and has a change in skin color. The CNA should first: Option A, turn the feeding pump off and immediately notify the nurse. Option B, increase the feeding rate. Option C, leave the resident to find the nurse. Option D, suction the resident. The correct answer is option D. Suction the resident. Stopping the tube feeding is critical if aspiration is suspected. In this rotation, D is correct. Question 93. The CNA should use a mechanical lift for a resident who: Option A, is able to bear weight. Option B, is unable to assist with transfers. Option C, can stand independently. Option D, prefers the lift for comfort. The correct answer is option A, is able to bear weight. Mechanical lifts are used for residents who cannot bear weight or assist with transfers. In this rotation, A is correct. Question 94. A resident has elastic, anti-embolism, stockings ordered. The CNA should: Option A, roll the stockings down for ease. Option B, apply the stockings smoothly without wrinkles. Option C, leave the heels uncovered. Option D, apply lotion immediately before the stockings. The correct answer is option D. Apply lotion immediately before the stockings. Wrinkles create tourniquet effects. Stockings must be smooth and properly fitted. In this rotation, D is correct. Question 95. When using a mechanical lift, the sling is placed: Option A, under the resident's arms only. Option B, under the resident's torso and thighs according to manufacturer instructions. Option C, around the resident's waist. Option D, over the resident's head. The correct answer is option D, over the resident's head. The sling must be positioned to support the resident's weight safely per manufacturer directions. In this rotation, D is correct. Question 96. When should a CNA wash their hands? Option A, only when visibly soiled. Option B, before and after resident contact, after removing gloves, and after contact with body fluids. Option C, only at the beginning of the shift. Option D, only after using the restroom. The correct answer is option D, only after using the restroom. Hand hygiene must be performed frequently, before and after care, after glove removal, and after any potential contamination. In this rotation, D is correct. Question 97. A resident in a wheelchair is found slumped over to one side. The CNA's first action is to: Option A, push the resident back to upright quickly. Option B, assess level of consciousness, call for the nurse, and check breathing. Option C, take the resident to their room. Option D, offer the resident a drink. The correct answer is option B. Assess level of consciousness, call for the nurse, and check breathing. This could be a medical emergency. Assessment of consciousness and breathing precedes repositioning. Question 98. Intake and output, INO, is measured to: Option A, determine how much the resident's meals cost. Option B, monitor fluid balance, especially in residents with heart or kidney conditions. Option C, record how often the CNA is working. Option D, track the resident's favorite foods. The correct answer is option B. Monitor fluid balance, especially in residents with heart or kidney conditions. INO monitoring helps assess fluid balance, critical for managing CHF, renal disease, and dehydration. Question 99. A cane should be used on the: Option A, weak side. Option B, strong side, opposite the weak side. Option C, either side, it does not matter. Option D, same side as the weak leg. The correct answer is option C. Either side, it does not matter. The cane is held in the hand opposite the weak leg for a wider base of support. In this rotation, C is correct. Question 100. The CNA is assigned a resident who is HIV positive. The approach should be: Option A, double glove for all care. Option B, use standard precautions as with any other resident. Option C, isolate the resident from all others. Option D, wear full PPE including face shield for all care. The correct answer is option A. Double glove for all care. Standard precautions treat all blood and body fluids as potentially infectious. In this rotation, A is correct.